Hello class, this is a short video presentation to help you be more prepared for tests. There is such a thing as test taking strategies, and if you do these things, you actually can become a better test taker, and it helps prepare you for the NCLEX. So the first video that I will be doing is talking about the actual things you can do in your life to make you a better test taker. The second presentation will actually talk about test questions. Each video is about 15 minutes in length. So when it comes to studying for tests, it's important to be prepared ahead of time. You need to start studying for your first exam the first day of class. So cramming for a test is a big no-no because you won't retain that knowledge, and especially for the NCLEX, you will not remember what you learned the night before. So what you want to do is make sure that you do your chapter work, you take your notes, you have study times like we've talked about, and that you do it on a regular basis. Make sure that you stay up to date with activities, do all the extra activities in your book. You have tables and charts and questions at the end of the chapter. Make sure that you are doing those on a regular basis. Study every day, even if it's just a half an hour. Go through the material, review the material so that when it comes to the test, you're comfortable with the material the night before, because you don't want to be cramming for the test the night before. When it comes to studying your material, make sure that you know what you're studying. If you come upon a word that you don't understand, look it up, Google it, whatever you need to do, because that could be such an important concept. And if you don't understand it, you may not have the building blocks to understand something later on. One of the suggestions is to use Post-it notes in your textbook, or sometimes just to make notes for yourself to have available when you're studying. When I talk about studying in chunks, if you're studying a chapter, let's say you have to study a chapter on musculoskeletal, study it in chunks. You might want to study acute musculoskeletal one day, chronic the next day, surgical procedures related to musculoskeletal. Whatever you're doing, break it down so that you study it in chunks, not everything running together. Your recall will be much better if you study it in chunks. Many people use flashcards or, again, Post-it notes or whatever when you're studying. What's nice about this is if you have some kind of format, such as using 5x7 cards that you take notes when you're studying, you can throw them in your book bag, purse, jacket, and pull them out if you've got 5-10 minutes to spare. If you're waiting to pick up kids, you can have these flashcards ready, and it's a great way to review. One of the best things you can do is analyze your past test scores. So if you have a test score that you're not happy with, make an arrangement with your instructor to review that test so that you can look at where you made the mistakes, incorporate some test taking strategies, especially if you see that you made a mistake. Could you have used test taking strategies to answer the question? When it comes to taking a test, make sure that you're listening to what your instructor says. If they're lecturing, especially if they're pointing out something, this is very important. If you notice they're going over material, that's sometimes a cue that's important, and you should study that. But mapping or outlining your course content is very important. Again, you incorporate that into a calendar and studying on a regular basis. I cannot stress that enough. Using songs, mnemonics, anything that helps you remember. Some students have songs for everything, and that's how they remember their lab values. There are some good books out there that have these kind of helpful hints in. One of them is Nurse's Memory Notebook. There's pictures. You can also draw those pictures. These are drawn for you, but there's some acronyms and things that help you remember different types of disease processes. An example of one is hepatitis that starts with a vowel is in the bowel. So hepatitis A and E is located in your bowel. The other ones are blood-borne. So it's a very easy way to remember how to determine which is bowel-related, GI-related, or blood-related. Break up your study times in manageable meeting units. Don't think you're going to study 4 hours a day. 1 hour of quality, good studying time is better than 4 hours of getting up, forgetting, that type of thing. And schedule them so that you have an appointment with yourself to study for the test and to get your work done. I know this sounds silly, but really, if you maintain a healthy lifestyle, good balance, get a good night's sleep every night, such as 7 hours, you're going to be much more prepared for the test than if you're going in on less sleep. Your brain just can't work as well and function as well. Again, never cram for a test. If you like to go with study groups, that's a good idea. Sometimes if right before the test, if you just meet with a group, go over test questions, sometimes someone else can explain something that you might not understand, and it just helps for you to get a better perspective and a big picture. Again, this is a personal thing. Not everybody likes study groups, but some nursing students have been very successful using study groups. One of the things you need to do when you are taking a test is develop a positive attitude. That kind of may sound a little crazy, but it's true. You do not want to walk into a test and think, I'm not going to pass this test. You're already setting yourself up for failure. You're going to walk in being very confident that you can pass the test. You've done the studying, you've laid it out, you're comfortable with the material, and you should be able to pass the test. Anytime you have test anxiety, and it could happen now, it could happen when you're taking the NCLEX, you should come up with a way to control that. And some suggestions are either controlled breathing or guided imagery. Guided imagery would be an example of maybe leaves blowing in the wind, or a palm tree on a sunny island, or anything you find really relaxing. Put that picture in your head, take some deep breaths, and you can get your body to react and slow down and open up the blood vessels and get that oxygen to your brain so you can answer the questions. So having the right attitude is really important. You've got your goal of becoming an RN. You need to break those goals down in smaller goals when you're studying for a class. Each class is a goal in itself, and each week you have learning goals. But if you have a good attitude that nursing is a great field to be in, you're learning something every day that you're going to use for the rest of your life, you're on your way to formulating that, the basis for a good attitude and being a good test taker. So you have a good attitude because you're studying well, you like the subject material, you're learning to learn something new every day, and you are going out and finding information on your own, not just what's in the lecture, but you're taking opportunities to explore and add to your knowledge base. So you do have faith in yourself. I suggest you find a support system in nursing school because it is hard, and you should have a cheerleader, someone who's going to slap you on the back or say good job or reward you after you've finished your chapter test or whatever. And it could be a family member, it could be a friend, but find a support system to help you in your nursing school journey. Again, take good care of your body and yourself. So we talked about accepting responsibility to learn, being an active participant. That means if you're in a classroom setting, you want to be sitting in the front, answering the questions, trying to soak in the knowledge so that you are getting as much out of it as you're studying for tests and eventually the NCLEX. So in summary, attitude is taking care of yourself, exercising, maintaining a healthy attitude, and knowing that you can do this, and rewarding yourself in the end after you've made these accomplishments, small accomplishments, which could be tests, as you're working towards your goal. The one thing you might need to realize is that in nursing school, you might have to balance sacrifice and rewards. So you might have to look at, we talked about setting priorities, and you might not be able to do as many things when you're in nursing school, understanding that in the end, the reward is really good, and you will have time to hopefully maybe attend some of more of your children's events, or work more hours, or whatever it is, but knowing that it is a balance, but the reward is very good. When it comes to taking tests, and this will be true when you take your NCLEX, is you need to manage your travel time and manage yourself before you take the test. And what that means is you've obviously developed a good attitude, you are getting a good night's sleep, you've got a good study system going, but now it's time to take the test. Whether it's online or in a classroom, you want to make sure that you are ready and there before the test with plenty of time. You want to have all the appropriate supplies. So if it's in the classroom, it might be pens, paper, pencils, anything you need to take that test, calculators. If it's online, you might need calculators, notepads, whatever. Make sure your computer's charged. The last thing you want is for your computer to run out of battery when you're in the middle of taking a test. Managing your personal comfort. What that means is you might find that when you take a test, you're much more comfortable in comfortable clothes, workout clothes, or you might find that if you dress up to take the test, you might get a better grade. So think about that. I personally would, for me, I would know I would do much better if I'm a little bit dressed up and feeling more professional. But it's personal preference, so you have to determine what is your comfort level. So when you get into the test, if you've studied in chunks, you've organized your material, that helps your brain go back to remember where was that test question. Sometimes you can remember it was on a Tuesday. Oh, I was studying musculoskeletal. Oh, okay. So you go back and remember the information in the way that you've studied. Decide what is important to study. Use the results of your NCLEX or any test that you've taken on campus to determine what your weaknesses are and go about studying those areas that are you may have not scored lower. So what I'm saying is if you've taken a pre-test, you might find that you weren't so strong in one area. So go back and study those areas to add to your information base before you take the test. Associate new material with past experiences. So if you're learning something new, can you relate it to something in your own life? Can you relate it to something maybe you've seen on TV? We've got many shows such as Grey's Anatomy, that talk about disease processes. And sometimes remembering something you saw in the show helps you understand. And a case could be like inhalation burn therapy that you saw on Grey's Anatomy. So think of that. That helps you build your knowledge base because there is so much to learn. Look up all definitions and remember we talked about this earlier, if you're studying and you have distractions, write them down instead of taking care of them when you're studying. If you're taking a test in a classroom, make sure that you find the best seat that you like, unless you have assigned seats. If you think you're better at the front of the room, back of the room, not close to a door, think about those things before you take a test. If you're at home, where are you going to take that test? Are you sitting on a desk in a quiet room? You don't want to be sitting on your bed. You don't want to be sitting in an area where anyone's going to start talking to you. So be prepared and ready for that test wherever it is. Make sure that cell phone is far away when you're taking an online test because you are timed for online tests, and if you take the time to answer a call or whatever you need, you will be taking a chance of not finishing the test. If it's at all possible, try to schedule a babysitter or take your test when your children are not at home because usually you become very important when you leave the room and you start taking your test. If you are able to look at the entire test, test taking strategy is to review the entire test and then start. However, again, if you're a time test, I don't always suggest that because that may take too much time before you get into the questions. Make sure that when you are taking a test, you are reading each question very thoroughly. It's usually best to read the question and the answer and then go back and read it again. During the test, take some deep breaths, relax, get that energy to your brain. Make sure that you're not becoming too tense because that ties up oxygen. So just wiggle around and take some deep breaths. Again, read each direction carefully. If you are taking a test in the classroom and you have a question, please ask the instructor for clarification. One of the things that works really well is called a mind dump, and if your instructor allows it, you ask for a piece of paper at the beginning of the test from your instructor, and as soon as the test starts, you dump everything in your mind on that piece of paper. So an example would be in studying metabolic and respiratory acidosis. There's a lot of formulas and things to remember about that. As soon as the test starts, I just write down everything I can remember so that when a question comes up, it's on that paper. It's not cheating. You're just adding it. It's your information. Plus, it frees up your brain for other information that you've already learned to take space. If you're taking a test online, do not use your book. First of all, it's not going to help you for the NCLEX, which is your ultimate goal. And usually it takes too much time. So you want to start getting used to taking tests as if you were sitting in a classroom and completing them without help of any kind of textbook. Keep an eye on the clock. So if you know you have 60 minutes, 70 minutes to complete a test, and you have 50 questions, you know where you're at along the way. Sometimes this technique does make people nervous, but it does also help you from not having the test stop. All right, then this will end. I'm going to go back to this side. This will end this presentation. And then the next presentation, we'll be talking about actually looking at test questions and how can I answer a test question with maybe not knowing the answer. And that's called test taking strategy.